Welcome to Pediatric Vaccinations Made Easy. This session, led by Dr. Favour, is part of the American Association of Nurse Practitioners and American Nurses Credentialing Center Board Review. Let's dive into essential vaccination knowledge for pediatric care.
Welcome to today's session on pediatric vaccinations. We'll cover essential vaccines from birth to adolescence, including hepatitis B, rotavirus, and more. Stay tuned for a practice question at the end. At birth, infants receive the first dose of the hepatitis B vaccine. The second dose follows at 1 to 2 months, and the third between 6 to 18 months. If the mother is hepatitis B surface antigen positive, administer both the hepatitis B vaccine and hepatitis B immune globulin to the newborn immediately. Rotavirus vaccine is oral, given at 2 and 4 months for rotavirus vaccine 1, or 2, 4, and 6 months for rotavirus vaccine 5, with strict age limits. Diphtheria, tetanus, and pertussis is a 5-dose series for diphtheria, tetanus, and pertussis starting at 2 months. Respiratory syncytial virus prevention involves maternal vaccination or infant monoclonal antibodies, not a traditional vaccine. Diphtheria, tetanus, and pertussis is for young children. Tetanus, diphtheria, and pertussis is a booster. Haemophilus influenzae type B vaccine protects against invasive diseases like meningitis and epiglottitis, but isn't routinely given to healthy older children or adults. Pneumococcal conjugate vaccine may require extra doses for high-risk conditions. Inactivated polio vaccine is inactivated. The United States does not use the live oral polio vaccine. At the 12-month visit, children receive the measles, mumps, and rubella and varicella vaccines. Measles, mumps, and rubella protects against measles, mumps, and rubella, while varicella targets chickenpox. Both are live vaccines, contraindicated in pregnancy and severe immunocompromise. Hepatitis A is also initiated, with a 2-dose series between 12 and 23 months. Measles, mumps, and rubella and varicella are live vaccines, with the first dose given at 12 to 15 months and the second at 4 to 6 years. If not administered on the same day, ensure an appropriate interval between doses to maintain efficacy and safety. At the adolescent visit, ages 11 to 12, teenagers need the tetanus, diphtheria, and pertussis booster for tetanus, diphtheria, and pertussis. The human papillomavirus vaccine is crucial for cancer prevention, starting at this age. Additionally, the meningococcal conjugate vaccine is administered, with a booster recommended at age 16. The human papillomavirus vaccine prevents human papillomavirus-related cancers and diseases. If started before age 15, it's a 2-dose series. At 15 or older, it's a 3-dose series. It can begin as early as age 9. Meningococcal conjugate vaccine requires a first dose at 11 to 12 years and a booster at 16. Special populations may need extra doses. Influenza vaccination is recommended annually, starting at 6 months of age. Children aged 6 months to 8 years may require 2 doses during their first flu season. This ensures optimal protection against influenza each year. At 11 to 12 years, the recommended vaccines are tetanus, diphtheria, and pertussis, human papillomavirus, and meningococcal conjugate vaccine. These vaccines are crucial for protecting against tetanus, diphtheria, pertussis, human papillomavirus, and meningococcal disease. Ensure timely administration to maintain optimal health during adolescence. For a healthy 12-year-old at a routine visit, the provider should administer tetanus, diphtheria, and pertussis, human papillomavirus, and meningococcal ACWY vaccines. These are recommended for the 11-12-year age group. Other vaccines like measles, mumps, and rubella, varicella, and hepatitis A are given around 1 year, while diphtheria, tetanus, and pertussis, inactivated poliovirus, and Haemophilus influenzae type B are for younger children.